So our focus now has shifted from the anatomic or surgical definition of what a congenital diaphragmatic hernia is to the functional aspect of it. We have new tools that we did not have 20 years ago, not the least of which is a simple substance called nitric oxide. We administer it to the baby's lungs through the mechanical ventilators they're on, and it relaxes the blood vessels that we're interested in having relaxed, so that blood flow through the lungs occurs as it ought to.
Well, this is baby Jalacia, who was transported here to MCV from one of the referral hospitals about 4 weeks ago. At that point, she was 26 weeks gestation and just at 1,000 grams, about 2.2 pounds. She's now 4 weeks old, which puts her at 30 weeks gestation, which is at that point in development, every week is critical. Sometimes every day is critical. So that's a huge difference, 26 weeks to 30 weeks. And she's now up to 1,230 grams, which is 2 pounds, 12 ounces. So she has a ways to go before she's big enough to go home, but she's come a long way. When we first encountered her at our referral hospital, she had a breathing tube in and was attached to a ventilator and needed quite a bit of assistance with her breathing and extra oxygen. We transported her here to MCV on the ventilator, and she was able to have that breathing tube removed about 3 days after arrival here, and went to what was called nasal prong CPAP. And she remained on CPAP until April 16th, at which point she went to breathing room air, just like you and I are breathing now. From what we've seen, from looking at her imaging of her head, everything looks really good and on target for her. She's done really well.
They said she's doing real good. It's like she's growing a little bit. Well, I done been through it before. My son, he was 1 pound and 10 ounces when he was born. This time, she don't have, any sickness dealing with it. He was sick when he was born. It is scary. I feel depressed.
Any idea how long she's going to have to be here?
I know. One nurse told me probably around my due date time. That was June the 25th.
So a few months she's going to be here.
Yeah.
Our focus is no longer on helping her breathe and whether or not she's going to live. It's more focused on getting her ready to go home, which is feeding and growing. Right now she is still feeding through a tube that goes down her nose to her stomach, because while she can suck, her ability to suck, swallow, and breathe all at the same time just isn't there yet. That develops around 32 weeks. So she's got a little bit more growing to do, a little bit more neurological growth before she's able to kind of coordinate all that together. She has a pacifier in her bed that we can provide. She can suck on when her feeding's going through the tube, so that she can start to associate that sucking action with having a full tummy. So she needs to get to a point where she can hold her temperature up in an open crib, dressed in just a regular t-shirt, not have to be bundled in a lot of blankets. She needs to be able to be taking all her nutrition through by mouth, through a bottle, and then she'll be on her way home.
Unfortunately, because we take care of critically ill neonates in this unit, sometimes we do experience the loss of a baby, and that's never easy for anyone. But I think our focus quickly shifts from taking care of the babies to then taking care of the families and supporting them through this most difficult time in their life.
Well, I had started having complications in my pregnancy and was admitted to the hospital for an extended stay. I ended up only being there a week or so and went into early labor.
Every step of the way, the doctors would take their time to come in and just tell us exactly what they were going to be doing, what they were attempting to do with the medication they were giving him, and trying to clean his lungs up and help him breathe better.
There was one nurse that was pretty much there with us the whole time from the delivery room, Erin. She was amazing. I feel like she'll always be a part of our family. When we finally did find out that he was not going to make it and there was nothing we could do, the processes that the nurse went through, because we had no clue, what do you do now? You're told your child's not going to make it. we just kind of sat there and we're like, we just looked at Erin and we're like, what do we do? She guided us through every step of the way. They brought us clothes for him to wear. They made signs for his bed all over. They recommended the Now I Lay Me Down to Sleep, the photographer, Debbie Silbert, who was amazing. We never would have thought to baptize him. You know, they got the chaplain in, they got him baptized. They let us completely take our time and everything that we did. His family lived 6 hours away. We were able to wait for them to get here. Then we got photographs with the entire family. And then all the family left and we had a few more private moments with him, and then we handed him to the nurse to take him night-night. It was very comforting to hand him to her and know how much she cared. It was amazing. We're still in touch with all these nurses. We love them.
That night we went up to her room and I spent the night in her room with her, and we were laying there and it was the saddest moment of our lives. But my brother's a pastor and I actually called him because I said, you know, this is the saddest moment of our life, but I said, we're both so at ease and we're so joyful right now.
We were just at peace.
We were so at peace because we had done everything we could possibly do with our child before and after he passed.
We don't sit here and say, I wish we had done this with him in the 3 days we had. I wish we had done that. Everything was as perfect as it could be for the situation we were in. And that is all because of where we were.
I like the fact that they're babies. They're programmed for growth and repair are very similar processes. And I like the fact that if they do get well, as most of them do, thank goodness, that what you've opened up the opportunity to is a long life.
I went into nursing because I wanted to feel like I was helping and making a difference in someone's life. And you definitely feel that here. So I think it's a great career to go into.
This is a great field. This is really, it has so much potential. I tell people you don't know whether you like medicine or surgery or orthopedics. You get it all here. You get the satisfaction of seeing just how much good you can do and then seeing people come back and bring their children and the joy that the kids have brought to their life. It's just a great place to work.
Sometimes when I walk out there, it's hard to just leave, and even though I'm going just to the other side of the hospital, it's still hard, you know. And sometimes like the other day, I stood over there and I was just holding him while I fed him, and I just started to cry. And, you know, the nurse, she came in, she gave me my tissue and just let me have my privacy. And sometimes it's hard to just let those emotions just go, you know, especially with other people around, even though you don't care because it's your child, but sometimes it wouldn't be easy to just express yourself. You know, you'd have to wait till you got back to your room and cry or feel whatever you feel. So if I ever get pregnant again, which I'm not going to say I doubt it, but I will be coming here first phone call.